Hello everyone, this is me, your host Sunanda, and you are watching NewsMeter. In today's Doctor's Talk, we have a myth-busting session with Dr. P.Neelima, Senior Consultant Gynecologist at Renova Hospital, with us to share some insightful knowledge on the topic.
On the breast milk, but not the taste. Taste will be the same. It is a quantity of milk which is affected because of the hormones that are related to the letting down reflex. That is breast milk to come out when the baby latch on, baby sucks. Then one hormone is released, that is oxytocin, that comes from the brain. The signal like anemia, when the blood percentage is very less and nutrition is not good to the mother, in those patients also the production of milk is very less because the body is not able to get the substances which are needed to produce the milk. So in these conditions, in special conditions only, mother cannot produce the milk. If the mother is healthy and in a normal pregnancy, every mother can feed the milk. But the fever is there. If it is 100 degrees Fahrenheit, the mother can feed the baby. If it is more than 100 and if there are any infection at the site of feeding, that is breast, especially at the nipple or breast infection is there, through that the baby will get the infection if they give the feeding. Medication for the pain or any other medication, which are vitamins or everything, those medications you can take. And if you have any, most of the common complaint in the pregnant ladies, we see the dental pain also, dental pain, urinary tract infections, and even gastrointestinal loose motions or vomitings. That type of infections will be there. In those, the safe antibiotics which can be used in pregnancy, you can use, that is prescribed by the doctor, gynecologist or the physician, that if you tell you are pregnant, they will give the safe drugs only. But some drugs which are very harmful to the baby, or some patients are on psychotropic drugs because they are in anxiety or depression or bipolar disorders, like psychiatry problems, or some patients with fits, epilepsy. They will have on some medication, and we advise these mothers to have a to consult their psychiatrist or the neurophysician, where they are having the checkup, to get into the smaller dose and the safe drug which will be used in pregnancy. So with the advice of the doctor, you can continue the other medication also.
All right, ma'am. So let's just wind up. And my last question to you would be: do you have any personal message for the breastfeeding mothers on this breastfeeding week?
The theme of the this day or the week is awareness, creating the awareness among the as many people as possible, and make sure that every mother feeds her baby because of the ideal nutrition and secure food. And when the baby gets this thing, even from the mother also is benefited from so many factors, because the mother loses weight because the calories go to the baby. And there are some cancers there, like breast and ovarian cancers will be prevented with breastfeeding. And the only thing is take good food and rest, which is very much important during that period. And especially the cooperation from the partner and the family is very very important for the mother to start breastfeeding and continue in the continuation of the breastfeeding.
Ma'am, thank you so much for joining us today. Indeed, it was a very special and fun session with you. We got to know a lot of new facts about breastfeeding. Thank you so much for joining.
Thank you.